All right, thank you everyone for joining us today. My name is Caitlin Dow, and I'm a Senior Nutrition Scientist for the Center for Science in the Public Interest. I'm here with David Sharp, our Senior Scientist, who has been writing about food and supplements for over 20 years. David will be discussing multivitamins, who might benefit from them, what they should contain, and which category of multivitamins is a poor choice for consumers. We will then have about 10 minutes for a Q&A session. Your microphones are muted, so please write your questions into the chat box at any time during the webinar, and we'll address as many as we can. We do want to make it clear that we have no financial ties with any supplement company, which allows us to call it like we see it. So with that, David, I will hand it over to you.
Well, thank you. Multivitamins, it's certainly a popular product that people take. 31% of us take it regularly. Well, that's down from 37% in 2012. And maybe headlines like this are maybe a reason for some of the decline. We see these headlines in medical journals. Other people, of course, claim that multivitamins are an insurance policy just in case the food we eat doesn't contain enough of certain nutrients. Now, just so that we're all on the same page, vitamins are by definition essential for health. And the minerals in multivitamins, well, we're talking about those that are also designated as essential. And of course, it should go without saying that we should be getting our nutrients primarily from food and not from supplements. Now, are multivitamins a waste of money? Well, probably, maybe for some they probably are. They may be eating a perfectly wonderful diet and have no particular extra nutrient needs. But for others, it may be a worthwhile thing to do. And for example, as you may know, the National Academy of Sciences recommends that older adults, those 50 and older, should get some of their vitamin B12 from synthetic vitamin B12. That's to avoid issues with digestion of the B12 from food. And almost all multivitamins contain an ample amount of synthetic B12. Another example is vitamin D. We're encouraged to get more and more vitamin D, but as you know, it's difficult to get that from a lot of foods. And most supplements now have ample amounts of vitamin D. Many of them have 1,000 IUs, and so it's an easy way for people to get their vitamin D. And another example is folic acid. We know that women of reproductive age need to get at least 400 micrograms of folic acid each day in order to prevent certain birth defects, and almost all multivitamins have that 400 micrograms. So multivitamins are a handy way for people to get the B12 they may need, the synthetic B12, or the vitamin D, or the folic acid. Those are just a few examples. But what about other health benefits? If you look at the epidemiological literature, it's difficult to tease out what benefits multivitamins have. And that's because people who take multivitamins on their own differ fundamentally from people who don't. They tend to eat better diets, they smoke less, they exercise more, and they weigh less. And so it's hard to figure out how multivitamins would help somebody like that in addition to their normal health habits. But one result does stand out from the epi studies, and that is multivitamin takers do not live any longer than non-multivitamin takers. So if you look at death as the ultimate outcome, multivitamins don't have much of an impact there. Now, what about randomized controlled trials, the gold standard of research? Well, there are not a lot of good randomized controlled trials of multivitamins. For one reason, they're expensive. They're very expensive to do, and most companies who'd have the most interest in doing them can't afford it. There's also the issue of borrowed science. If one company shells out a lot of money for a study, then everyone else can use the results to sell their own product. So naturally, companies are not willing to do that. The best controlled trial, randomized controlled trial, is the government-funded Physicians Health Study 2, which started reporting the results in 2012. This was run by Harvard researchers, and they randomized more than 14,000 physicians who were 50 and older to take either a placebo or a popular multivitamin, in this case Centrum Silver, to take it every day for an average of 11 years. They had excellent compliance. I spoke with some of the researchers. They talked about how the physicians would carry their blister packs of either placebo or multivitamin with them all around the world and have their picture taken in front of world monuments like the Taj Mahal. They were so proud of how compliant they were. So it was a really well done, very large randomized controlled trial. The results, well, the multivitamin takers in this case didn't live any longer than the non-vitamin takers. That's no big surprise. They also also didn't have any fewer cardiovascular events like stroke or heart attacks, and they didn't have any slower cognitive changes, so that's disappointing. However, the men who were taking the multivitamins had an 8% lower risk of cancer. They also had a 9% lower risk of cataracts. Very impressive. For me, it was personally a deal maker. I started taking a multivitamin every day after that. Figured, wow, 8% lower risk of cancer. What have you got to lose? And why wait for another trial to confirm that? Wait 10 years or more when you can be taking the multivitamin in the meantime. But a major problem with this study is that how generalizable is it? Clearly, what does it say about women? Well, it doesn't say anything about women. We don't know if the same results would apply to women or to younger people who are younger than 50. Now, the Harvard researchers are trying to make up for that. They're now starting out a study called the Cosmos trial, in which they're going to recruit both men and women to take multivitamins. The men have to be at least 60, the women 65. So if you're interested, or if you know somebody else who's interested, they are recruiting for this study. Now, there are other supposed health benefits from multivitamins that you'll see if you look at what the multivitamin manufacturers say, such as heart health, brain health, eye health, and skin and memory. But our advice is don't rely on these. These are structure function claims. If you know about them, you know that the FDA does not vet them, does not require companies to substantiate them. So companies are pretty much free to say whatever they want. But for example, the B vitamin claim up there, B vitamins to help promote heart health, that's based on the now defunct notion that if you can reduce homocysteine levels, then you can reduce heart disease. And that's been disproven in at least 6 well-done controlled trials that does not happen. And that issue is dead in the scientific world, but it's still alive in the multivitamin world, and manufacturers keep making that claim, and FDA doesn't stop them. In fact, it's largely up now to attorneys generals of various states, private attorneys, and nonprofit groups like our own to challenge some of these claims. For example, we challenged Centrum when they implied that the vitamin D in their multivitamin could prevent breast cancer, and Centrum withdrew that claim. We also threatened to sue Bayer when they claimed that the selenium in their multivitamin could prevent prostate cancer, and that was after the SELECT trial was terminated. That trial found that selenium supplements did not prevent prostate cancer. Ultimately, several attorneys general sued Bayer successfully for making that claim. And another example that didn't get a lot of publicity, but Pharmavite, which makes the Nature Made brand of multivitamin that you see in every drugstore, they claimed in ads that their multivitamins, the vitamin D in their multivitamins, could boost the production of antibodies. Now, there's no evidence that that's the case. So we emailed Pharmavite asking them what was the basis for this claim. And the response was, we're no longer going to make that claim. We're withdrawing it from our advertising. So that just gives you an idea of how solid these other product benefits are that the multivitamin manufacturers claim. Now, how do you go about choosing a good multivitamin to take? Well, I think first you have to understand that the ingredients in multivitamins are very, very cheap and readily available to everyone. In fact, most manufacturers get them from the same source, and that's mostly from China. And to give you an example, if you've never visited Alibaba.com, you really should. It's the Chinese equivalent of eBay for manufacturers, and that's where you can get bulk supplies of vitamins for very little money. You search for thiamine or riboflavin, in this case ascorbic acid. You could buy it by the kilo, you could buy it by the barrel. It's very inexpensive. You can get a year's supply for one person for I think under $1, but of course you can't just buy that amount, you have to buy it in bulk. But a few cents will get you a lot of vitamins, and this is what most manufacturers where they're getting their supplies from. And so they're all getting it cheaply, and they can't really compete on price. So that's why you'll see a lot of supplements, multivitamins have extras added to them or make extra claims. For example, they jazz up their product to make them look better by supersizing the amount of vitamins in them. They borrowed a page from McDonald's. McDonald's found that you could supersize French fries for very little money, add a few extra fries, and people were really pleased with that. And so vitamin manufacturers do the same thing. They'll double or they'll triple the amount of B vitamins in their multivitamin at almost no cost, and have the customer think, oh, I'm getting something really high potency, something that I should spend more money on. We also get questions from our members and from the public about whether some of these vitamins are synthetic and therefore worthless. which of course is nonsense if you know about the history of vitamin research. Synthetic vitamins have been used for 70, 80 years in nutrition research successfully. Much of what we know about vitamin literature is based on the testing of synthetic vitamins. We also get questions about whether these vitamins are absorbed, whether a tablet containing a bunch of different nutrients it dissolves properly. Some people believe it can't. There's this urban myth of seeing pills on x-rays, x-rays of people's guts, seeing the pills undissolved. Well, that turns out not to really be a problem. ConsumerLab.com, and if you're not familiar with ConsumerLab.com and you're interested in dietary supplements, it really pays to visit them. It's a subscription website. You pay a subscription to get access to their data, but this company has been analyzing the quality of dietary supplements for 17 years now. They've analyzed thousands and thousands of supplements to see if they have what they're supposed to have, the amount that they're supposed to have, and if they're labeled properly. Well, in their last survey of multivitamin supplements, Consumer Lab tested 34 popular brands of multivitamin tablets to see if they dissolve properly, and only one didn't. And it wasn't the cheapest that didn't dissolve. It was one of the more expensive ones, one that cost 42 cents a tablet. Interestingly, the dollar store's brand dissolved properly, so it turned out to be a relatively high-quality dietary supplement. So we've, in order to help our members, we've devised a list of what we think a multivitamin should contain. And we base this on the recommended dietary allowances. We've also based it on safety issues in the literature. For example, there's some concern about too much calcium for men, maybe causing, increasing the risk of prostate cancer. And we also based it on what's generally available. We're not going to make recommendations for products that people can't find. Now this slide here is hard to read, but the point is that we found, using that guide, we found plenty of multivitamins that met the basic, what we think are the basic requirements, and many of them are inexpensive. For example, Centrum, which is by far the most popular dietary supplement, costs only about 7 cents a tablet, about $2 a month, certainly affordable for most people. Now, one category of supplement, though, that we've looked at is a problem. It stands out as a problem. And that's the ones that are supposedly easier to swallow. These are the gummies, the chewables, the liquids, which are becoming more and more popular, maybe because that's the population is getting older and having more trouble swallowing tablets. But what we found was that almost all of them fail to meet the basic requirements of a multivitamin. Some of them were missing 5, 8, sometimes 9 nutrients, which is ridiculous if you're trying to get a dietary supplement having missing so many of the essential vitamins and minerals. We found only one that really came close to matching a good tablet, and that was the Centrum chewables. It's the one on the second line there. That one came the closest. It doesn't have iron because generally adults of 50 and older don't need more iron. It was missing only vitamin K, which, to be fair, most multivitamins don't seem to have much K at all, if any at all. So our conclusion is that if you can swallow a tablet, you and your pocketbook are much better off with a tablet rather than one of these, which usually costs several times what a multivitamin tablet costs. So are multivitamins a prudent insurance policy, or are they a boondoggle? Well, there's no one answer for everyone, but certainly for some people it can be a valuable and sensible insurance policy to get certain nutrients. If they don't pay too much for the multivitamin, they shouldn't have to pay too much. We usually tell people you shouldn't have to pay more than $5 a month for a good multivitamin. If you pay more than that, then maybe it is a boondoggle. And now we also want to point out that supplements are not a substitute for actual health insurance or a health insurance policy. We're concerned at CSBI that the supplement industry's health claims appeal to some people in the low-income communities who are worried about their health but can't afford to see a doctor or go to the hospital, and that instead they'll spend their money on expensive supplements thinking that that was going to help them when it may not. So we're concerned about some exaggerated claims appealing to people who are vulnerable financially. And with that, I think we can take some questions.
All right, great. Thank you, David. So we've had quite a few questions come in. One that we see repeatedly is people want to know, how safe are multivitamins?
Well, they seem to be pretty safe. There was a study a few years ago that rattled some of us, some of the public, found that women, middle-aged and older women in the Midwest who had been taking multivitamins for more than 20 years had a higher death rate than those who didn't. That obviously and understandably concerned people, but that study appears to be an outlier. Almost all the studies, and there are now more than 24 of them that have looked, these are epidemiological studies, have looked and have found no greater mortality, if you use that as the ultimate outcome, that there's no greater mortality among people taking multivitamins than people who don't. And in most of the studies and the randomized controlled trials that are done, people who take multis don't report any more symptoms, any more adverse reactions than people taking the placebo. So I think by and large they're safe. Of course, that if you're taking something really crazy with crazy amounts, well then all bets are off.
All right, good to know. And some people are concerned about the quality of their multivitamins. A lot of people are searching for organic foods and organic vitamins. Is there any way that consumers can be reassured that their vitamins and minerals are organic?
Well, first of all, we should point out there's not much research on multivitamins in general, but there certainly isn't any research showing that an organic vitamin is any better for you than a synthetic vitamin. If there is, that research hasn't been done. But if you're concerned, if you want to support organic food production, organic nutrient production, then you should look for the seal, the National Organic Standard seal on a package, which is certified by third-party auditors as being really organic. So if that's an issue important to you, then look for that seal, but don't feel guilty or don't feel like you have to spend extra money to get organic if what you're concerned about is just getting those nutrients.
Okay. Do you think that it's better to take a multivitamin or individual vitamins and minerals?
Well, if you try to get all the vitamins and minerals, then it's pretty expensive to get them individually. Plus, usually the individual pills will have higher levels of nutrients because they think people are trying to load up on that particular nutrient. So unless there's one nutrient that you think you really need, and there are some, I mean, people might want to get extra vitamin D or calcium. If there's that one or two nutrients, then maybe it makes sense to take those individually. But if you're trying to duplicate what a multivitamin has, it really doesn't make much sense to take them individually. You'd be spending a lot more money, and of course it's a lot less convenient to be taking a lot of pills each day.
A lot of people talk about absorption of nutrients from multivitamins versus from food. Is there good data to show that multivitamins, that you absorb as many from a multivitamin as you do from the food itself?
Well, actually, the research is mixed. Certainly, multivitamins are well absorbed. That's been demonstrated in studies. Are they better than food? Well, in some cases, no. In some cases, yes. Folic acid, for example, is much better absorbed as a synthetic folic acid in a multivitamin than it is absorbed from food. Beta-carotene is better absorbed as a supplement than getting it from carrots. But there are advantages to getting those nutrients from food too. So you want to be getting your nutrients primarily from food, and if you use a multivitamin, it should be used only to supplement what you're eating.
I've read a lot about people having allergic reactions to multivitamins. What could cause an allergic reaction from a multivitamin?
It's hard to understand how someone could have an allergic reaction to a multivitamin. True allergic reactions are due to a protein, an antigen, and there shouldn't be any protein in a multivitamin. Maybe somebody believes that they're suffering some other kind of adverse reaction to a multivitamin. It's certainly not very common. It's very rare. Perhaps they're very hypersensitive to some other ingredient, maybe a food coloring or something like that, although there's very little food coloring in some of these multivitamins, only trivial amounts. So it's not something that most people should worry about. If somebody does feel like they are reacting adversely to a multivitamin, then our advice would be to try to find one that you don't, or consult a healthcare practitioner you trust who may have some experience with this and may know some particular brand that their patients don't seem to have a problem with.
Okay, great. What are your thoughts on the recent recommendations to avoid taking calcium supplements due to their potential connection with heart disease?
Well, we've published on this before. The best evidence from the best controlled trials shows there's no increase in cardiovascular disease or cardiovascular events in those taking calcium supplements. Some lesser quality studies have raised concerns, but if you go by the best evidence, the best randomized controlled trials, there doesn't seem to be a problem with taking calcium supplements for your heart or for your cardiovascular system.
Okay, great. And how long do you think that multivitamins should be taken for?
Well, they're meant to be taken each day. Now, you don't. A lot of people think you have to take the water. You have to have water-soluble supplements, water-soluble nutrients every day because they're lost in the urine. That's not true. You don't. If you don't eat for one day, you don't die the next day from a nutrient deficiency. You don't start developing scurvy the next day. We all have stores of our nutrients, even the water-soluble ones. We have months of storage of them before we start to run out. So multivitamins are meant to be taken every day to replenish nutrients, but they don't need to be taken every day. But really, the only ones I can think of, if a woman is pregnant, she may take vitamins during that time as a special circumstance, and then discontinue them afterwards. Otherwise, most people, it's meant to be taken every day. But if you miss one or even a week, you're not going to die. You're not going to hurt yourself probably. You probably have ample stores of nutrients.
Okay, great. Do you have any opinion or information about expiration dates on multivitamins and how accurate those are?
Well, no. First of all, nobody's testing. If you think FDA is testing to see if the nutrients are still good by the end of the expiration period, no, they don't do that. They don't have the staff, the resources, and it's probably not a big problem, at least for the major manufacturers. Major manufacturers have a lot to lose if they put out a poor product, and so a good manufacturer will store their products over periods of time and then test them to make sure that their expiration dates are correct. So, and nutrients are not, it's not like salad that goes bad after a week or two. The nutrients are fairly stable. So I think as long as you consume the multivitamin while the expiration date is still active, it hasn't expired, then I think you're pretty safe. Now, I wouldn't buy a multivitamin that's already expired. It's nothing wrong with it, but why? It might have lower levels of the nutrients you're interested in. So why do that when you can easily find a product that's not expired?
Yeah. And what about some of the nutrients that many people have never heard about, as far as chromium, a lot of more minor nutrients that are often in multivitamins? Do we need all of those, or are those excessive?
Well, for chromium and for other minerals, there's good evidence that they may be helpful for our good health. Certainly some of them are essential. Iron is essential. Iodine is essential. So some of them are essential, and that's why they're there. Others, there's good evidence that they help promote our health. So a good multivitamin will have those nutrients identified by the National Academy of Sciences, which is an organization of experts who look at the evidence for nutrients and designate which ones are essential, which ones are important, and in which amounts. And a good multivitamin will follow that by following the recommended dietary allowances that the National Academy of Sciences produces. So in our list of the nutrients that a multivitamin should contain, we list only those that are either essential or for which there is good, solid evidence that they're important for our health.
And outside of what CSPI has generated, are there standards from any governing body like National Academy of Science for what a multi should contain, or is that up to the manufacturer?
Well, manufacturers are free to put whatever they want in the multivitamins, and in fact, you'll see in a lot of products they add all kinds of other miscellaneous stuff, herbs and other compounds that somebody somewhere sometimes said was important. But most of them, well, at least most of the reputable brands, will follow what the National Academy of Sciences says and include only or mostly those nutrients for which there's established requirements or established recommended levels. Now, one thing you'll see is that sometimes manufacturers put in crazy amounts. They'll put in something that's over the RDA, and there's no rhyme or reason why they added that amount. And it's hard to figure out why they would, since there's no evidence suggesting that those particular amounts are any more valuable than the RDA. So you will see crazy amounts, but there's nothing illegal about that. Manufacturers are free to do it because, as you may know, dietary supplements, including multivitamins, are loosely regulated by the Food and Drug Administration.
Okay, and do you have any suggestions for vegetarians or vegans who may tend to be low in certain nutrients? Are there certain nutrients that they should look for in a multivitamin compared with other people?
Well, the clear one is vitamin B12, which is most commonly found in animal foods. And so I think most vegetarians and most vegans probably know that and may choose foods that are fortified with vitamin B12, which is fairly easy to find, or take a vitamin B12 supplement. So that's the one nutrient I think that is of most concern for people who follow a vegetarian or vegan diet.
Okay, and what about for prenatal multivitamins? Other than folic acid, is there anything else that a prenatal multivitamin really needs to contain?
Well, I think you should probably follow what major manufacturers produce in their prenatal vitamins. So they generally, again, large companies have a lot to lose if they don't produce good quality products. So I would choose a major brand, and I would also follow your pediatrician or OBGYN's advice about what prenatal vitamins to take.
Okay, and a number of people have asked this, and even though you addressed it in the webinar, it might be good to address again. Some people have asked about liquid and chewable vitamins. Are the standards or effectiveness the same?
Well, it depends on what standards you're talking about and effectiveness you're talking about. They start with the same nutrients, although not as many of the nutrients and often lower levels of the nutrients, but those are the same nutrients that they get from China that other manufacturers get from China, and the same nutrients that go into the tablets. It's that there are fewer of them and often lesser amounts of them that's the problem. Now that may be due to sometimes there's bitter taste to these vitamins, and they may be unable to mask the flavor. I mean, one of the advantages of gummies and liquids is that they taste better, and they may not be able to put in all the nutrients that they want because of taste problems, and there may be other manufacturing problems. So there's the vitamins and minerals that are in those products should work just as well as the vitamins and minerals in tablets. It's just that there are not enough of them.
Okay, and for one final question, you provided some lists in this webinar. Are these available on the website? Do consumers have access to all of these lists?
If you're referring to the list of what should be in your multivitamin and which recommendations, which products out in the marketplace satisfy those requirements, subscribers to the Nutrition Action Health Letter have access to that in their November issue. So subscribers have access to it. And you can check us out on social media. We often reproduce that material on social media, and also in our nutritionaction.com tips that we email out to people who sign up for that service.
Okay, great. So with that, we are going to conclude. We would like to thank you all for participating in the webinar. We've received a lot more questions than we could answer today, so we'll try to address these in future Nutrition Action posts or potentially another webinar. Like David said, to get more evidence-based nutrition information on multivitamins and much, much more, please follow us on social media. You can also sign up for our free email newsletter and subscribe to Nutrition Action Health Letter, the largest circulating nutrition newsletter available in both print and digital forms. And if you're interested in supporting CSPI's work to investigate the efficacy and safety of supplements and to stop unfounded health claims on supplement labels, please go to the CSPI website to make a donation, and that website is cspinet.org. We will be hosting another webinar later this month. The date and topic are to be determined, so please stay tuned, and thank you again for participating in this webinar.